Welcome back to another episode of the Clear Skin podcast, and it's a baby day here at Clear Skin Solutions. We got Amelia's new baby Magnolia. Nikki's holding Magnolia, and I've got my little baby puppy Arthur here. So it's fitting for today's topic because we're going to talk about a topic that often causes a lot of skincare issues, and that's pregnancy and skincare. So, Amelia's a new mom herself, and so she's going to bring us a unique perspective into this discussion so that we can help y'all navigate through your pregnancy, whether it be pre, post pregnancy, whether you're planning in the future or you're just interested in learning more about your skin during these changes that are going to be happening or are happening to your body. So, Amelia, let's start with, can you, as a new mom and a skin specialist, can you share some insights into how pregnancy can affect the skin?
Absolutely. I just had a baby 6 weeks ago, so I'm very close to this experience. It's very fresh for me. But in the beginning, I had things that were a little less manageable, that were kind of outside of my control. And so in the first trimester, I wound up doing a progesterone suppository, which progesterone is a hormone. So people who end up doing progesterone suppositories in the first trimester or ongoing to keep their pregnancy healthy end up having like a huge purge of hormones in the body, and in some cases can get cystic acne, and in my case I wound up getting essentially like sores. They look like insulin resistant sores, and I started getting them all over my face. My skin became incredibly sensitive. When we start having huge hormone fluctuations, we start having big changes in every part of our body, including our faces. Mine in particular was melasma. So I've suffered with melasma my whole life, but when I get pregnant, it gets super bad. I start getting it like around my mouth and all
melasma
my cheeks.
masks.
Yep, exactly. It looks just like a mask. And
or pregnancy mask, either one.
Yep. And people always talk about pregnancy acne, and that's just because of the hormones in our body. A lot of times it doesn't have anywhere to go, so our skin purges it, and that's just the way that it is. I also, with that sensitivity, I started to get a lot of texture. So then I started looking a little bit older. A lot of people will say that girls take the beauty from you, and I would say in my instance, it was correct. I started looking a little bit older just because my skin started kind of getting thicker and more sensitive and textured with a lot of pigment and cystic and sores. Yeah.
That's a lot. That's a lot to have to deal with. So, we want to understand some of these pregnancy triggers that can happen on our skin. So, how do they differ from regular triggers at other times during non-pregnancy or postpartum? They don't.
A lot of times when we have hormonal issues, they show up the same way. So people with hormonal issues are going to have symptoms that look a lot like pregnancy symptoms, right?
Interesting.
Yeah.
Yes.
Where we're going to have the melasma, that insulin resistance with the sores. A lot of times it's a portrayal of diabetes. And so we end up seeing a lot of the same things, but it's condensed and a lot stronger during pregnancy. So it's easier to name, right? Like now I know exactly where it's coming from, as opposed to not having to dig a little bit deeper and finding out that you've got other stuff going on,
Yeah, that makes a lot of sense. And I know during pregnancy too, we have the tendency to eat foods that, we might not normally eat during regular times. We have those cravings. So, I think it's important to just be kind to yourself and try and nourish nourish you and the baby with nutrient dense whole foods, kind of keep sticking to that, that healthy diet, right? And that also plays a big factor in supporting the skin. All right, let's talk about safe skincare practices during pregnancy. Nikki, is there any specific skincare ingredients that should be avoided during pregnancy or pre and post, or during pregnancy, postpartum? And are there some safe alternatives?
Salicylic during breastfeeding and during pregnancy is a no-go. That one you just remove. And the good news about that, as long as you don't have any sensitivity, are the L-Mandelic is without alcohol, which is called our renewal, and it has lactic acid as well. So it's really pregnancy safe. It's really, really good for your skin. So you can go without the salicylic. Now, vitamin A's, it depends on their strength. It depends on the formula. So we highly recommend that you get it approved. Any prescription vitamin A's are out. It's too irritating and too strong. And it can cross the line, but
Across the placenta.
yes, it can cross the line, which is the placenta line. Azelaic acid is another one that's really good for melasma, and it's really good for also, it's another safe acid if you can get your hands on that, making sure that there's nothing else in that formula that's unsafe. Yeah.
Okay, so
acne gels are fine.
are they okay? So like the benzoyl peroxide is okay for pregnancy?
Yes, there's a story out right now that it's not safe. So there's a few people that are concerned. As long as you don't leave your acne gel in your car at 140 degrees for a week, we're good. But I don't recommend you leave product in heat ever.
No,
it needs to be kept cool.
Okay.
No, and I don't know anybody that would leave our products out in their car.
No, they're precious.
They're precious.
Precious.
And another really, really important product I watched you use quite a bit of it is peptide. Peptide was like your go-to.
Those copper peptides in there really helping with the healing.
Yeah.
Especially when
Healing
you've
and
got that
calming.
sensitivity
Yes.
happening, right?
Bring that for sure.
Awesome.
Yeah.
Okay.
And then
So-
something to remember that Nikki did touch on is that checking in with your doctor.
So even if you're recommended, like the azelaic, is that how you say it? And the L-mandelic acid, should we still
Check in with your doctor? Yep. Products approved.
Okay, awesome. All right.
As soon as you email us, we will send you a list of your ingredients so that you can take it to your doctor. Yes.
Sounds good. Okay. So what about like those who want to maintain their skin? It's really important that we develop a pregnancy safe skincare routine, right? So can we share a little bit about what that basic skincare routine that would be tailored more for pregnant individuals would be?
Yeah, of course. So it's going to be a lot of nutrient dense things that are going to be replenishing our skin. When you're pregnant, it's such an odd time in your life in the sense that you're kind of living on a different planet, and you don't really realize that you're on that planet until you come out of it and you're back to the real world. But what you realize when you're back to the real world is how much nurturing that you really need within pregnancy, because you're just in such a vulnerable place, and it's beautiful, and things are transitioning really quickly and your body's changing. And so having those moments, morning and night, where we can do something for ourselves that's nourishing for us, that is a beautiful moment of self-love, where I just get to be in this space that I'm in and take care of myself. And so here at Clear Skin Solutions, that's our essential basics, of course, which we're always going to be talking about for the rest of our days. But just keeping away from things that are going to be irritating our skin or triggering any type of histamine reaction, because it comes easy when you're pregnant. Your skin just kind of freaks out. And so I really like to use like a hydrating toner, which hydration toner is what comes in the hydration or essential basics kit. You can also use like a lactic acid toner, as well as our illuminating tonic is really great to like stay on your course of reducing pigment or preventing pigment so that you're not getting a lot of it during your pregnancy. We also have a few really good serums, like Nikki was talking about. Our L-mandelic serum is fabulous. We've got a few other serums if you're looking for recommendations based on your skin type. But just finding things that are non-irritating, that are going to be good for you, so we can get that pregnancy glow exactly where it's supposed to be.
Yes.
Yes. So outside of skincare products, is there any lifestyle changes, or I know we just talked a little bit about self-care practices and having that time to take care of your skin, but is there anything that our listeners can adapt or can adopt to help manage their skin?
So there's going to be the things that are just going to be bringing down inflammation in regards to our diets. Something Nikki had mentioned earlier is, when we start having these hormone changes, our bodies start telling us that we need different types of foods. And then a lot of times we end up kind of falling off of our diet or eating things that we're just kind of craving that aren't the best for us. And so just kind of staying on top of that, or choosing good things so that we're staying away from dairy and things that pick up our inflammation. Starting a multivitamin that is specifically for prenatal. prenatal multivitamins that are clear skin, like specifically the one we have at Clear Skin Solutions, are going to be free of biotin. Biotin tends to be a huge acne trigger. They're going to have the correct amount of zinc and iron and all of the good stuff that you need to nourish you and your baby's brain and growing heart. But they're not going to have the stuff that's going to be causing you acne. So like iodine, vitamin B12, and then again, the B7, which is a biotin. So making sure that we're sticking with taking supplements that are good for us and our skin, as well as, well, you said excluding products. So of course I'm going to jump into the products again, but staying on things that are keeping your skin exfoliated chemically and nourished.
Right.
A
Okay.
lot of times we're watching people come in that are pregnant, that are breaking out horribly because they are on high amounts of biotin on their prenatals. So this is a huge one. Also in lifestyle is a lot of people end up bringing back fabric softener, or because they're wanting the good smells, right?
Right.
And laundry soap that they got for their babies that says that it's germ safe, but it ends up having fragrance and SLS in it. So those can be another two that can be an issue.
Even baby lotions with pore cloggers. If you put lotion on your baby and then touch your face, we're going to get acne. I've noticed the majority of them have pore cloggers and irritants in them.
Yes, or curl up to your baby.
Yeah,
right?
exactly right.
Because I'll end up seeing lots of moms that have like breakouts here, down here. And I'm like, it's just you holding your baby with all of her pore cloggers. So what do you do about that?
I check ingredients.
So what
Yep.
about for those who, now we talk about always seeking professional guidance. We want to make sure that we're guiding you to the right outcomes. But at what point should, like if somebody is really struggling with their skin, when should they seek that kind of extra help from a skincare professional?
Well, one of the things that is really important, somebody had said something about, when should they go to a dermatologist or when should they go to a skincare professional? I'm always like, it's really important to find a person that specializes in your problem, right? Like that specializes in it, because we see a lot of times that it's just not, they're really good at their jobs, but they're not acne curious or trained. We're super acne curious, right? And we want the best training possible to help each individual get clear and get to the root of the issue. So it's a much more holistic approach. We can always get to the root of the issues. And sometimes people choose not to change the root of the issues, and they get to do that. But I think it's really important. You don't have to wait till it's severe or cystic. You can just have bumps. I think that when Amelia was just having her bumps, that was the hardest part during her pregnancy, is that she was just getting bumps all over. And that's when she had to do the supplement. So I think you get to reach out for help no matter what.
Right.
Right.
Pregnant or not, right? Amelia, as a new mom yourself, can you share any tips for managing pre and postpartum skincare concerns? Is there anything like postpartum that would be important to keep in mind?
Yeah, of course. What we were talking about before with the self-love aspect, a happy, healthy mom equals a happy, healthy baby. And I think that a lot of women, when they have children, they think that they have to put their baby first. And of course, effectively keeping your baby alive and making sure that they have everything that they need and not ignoring their, basic everyday needs is important. But making sure that we're finding the time to do the things for ourselves that keep us happy. And I think that a lot of times skincare gets to be that for me, whatever it is for you. And also another note, after you have a baby, you have a huge hormone dump. Everything changes super quickly. And everything with your skin and your postpartum body and everything that you're looking at after you have a baby is completely different. And so expect that you're probably going to have breakouts, and that along the lines of skincare, it's not completely linear. Sometimes we go backwards, and that we also get to have love and grace for the body that we're in right now that just made a baby and everything that is going through. So, on the other notes of using proper skincare and gentle exfoliation and hydration and all of those things, but I think most importantly, it's just going to be taking care of yourself.
Yeah, and that's super important. I mean, I remember when I had my babies, and it was like I only had one hand to do everything, right? Because my other hand was in use holding a baby, taking a shower, and if I could go back, I'd probably prioritize a little bit of time for myself if that option is there for sure. So
Yep. And to expect that we've got a path to go with our
yeah.
skin, that it's taken some time to get here and it'll take time to get back.
And be gentle and kind to yourself, right? And just know that you can get back to where your skin was before. This is not a permanent thing that you have to deal with ongoing. So
Absolutely.
Any recommendations on your diet after baby?
Oh, high fat, high protein, low carb. And like get all the inflammation out and the water retention, start working on our elasticity and getting our skin right. And me personally, my melasma is really picked up by my diet. And so if I've got a high carbohydrate, really processed food diet, my melasma gets horrible. So now we're just working on all of the damage that's been done the past year.
Well, I will say you look absolutely fabulous for just having a baby. So you've
Thank
done
you so
a
much.
great job. Okay, before we wrap up, is there any final words of encouragement or advice that we have for our pregnant mamas when they're navigating their skincare concerns?
I just think be kind, be kind, be kind, reach out, ask us for help, send us a text. We'd love to help you. Just be kind, be gentle, and meditation, breath work, yoga, anything that you can do just to support yourself at this time.
And stay connected and give yourself lots of
Yes.
grace for what you're going through and seek help when you need it, whether or not it's for skincare or it's for,
Yes.
mental health. There's a little place in town. It's called Nurturing Mamas Network. And it's a little therapy office that they've got like doulas and like lactation support and everything there, but they're kind of meant for women in this era who are new moms or moms who have gone through loss or pregnant or whatever it is along that journey, but just making sure that we're getting the help that we need and we're feeling good in the skin that we're in.
It's such a beautiful thing to watch because we were pretty much told to go in the other room and be quiet and and that's not good for mental health. This is
Right.
a beautiful path going down, is getting that support.
Yeah, most definitely. Yeah, absolutely. And we need it, right? And it's okay. It's okay to take it, right? Like this is, if you're not going to take it before and you're go, 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 but take it now, take this time and enjoy, right? Enjoy it all. And, don't stress so much about your skin, just keep it maintained, do all the things that you've been doing, things that we've talked about throughout our whole year plus of podcasting all about skin. So that's awesome. Well, baby Magnolia is sleeping and my little baby Arthur, he is sleeping as well. So they did good. They did good. I don't have, doggy pregnancy skin, but I might if I rub my face.
That is another funny one, is that people that get their dogs groomed can break out.
Yeah.
Delia, we had a virtual client together that she had to stop having her cat sleep with her because it was breaking her out. And she stopped her rosacea, her breaking out once the cat left the room.
Yeah.
Yeah. So
good to know. Okay. Well, thank you for sharing all of our pre and postpartum tips for great skin. And we will be back again next month with another episode. So be sure to reach out to us, info@clearskinsolutions.com. You can go to our website, clearskinsolutions.com. You can reach out to us, through our social channels or through email or phone. We're always here to support you, and we love babies, and we want to make sure that your skin stays happy and healthy. So thank you, ladies, again for sharing all your info, and we will see everybody next time.
thank
Thank
you.
you.
Bye.